So let's just talk about cervical spine. So this happens to be a cervical spine of a patient, where the model shows this is the front, that's where your throat is, this is the back of the head, their neck, and the nerves come from the brain all the way down to the cervical spine down here. So in the front, you have vertebral bodies and disc space in front, and you have a vertebral artery that goes from the side to supply the blood to the head. So what happens is, as time goes on, people can get degeneration or disc herniation from the front, and you can get spinal stenosis with these pinched nerves. Where the nerves go, they're getting squeezed. They start having this much room. So the first line of attack is always conservative therapy, physical therapy, anti-inflammatory, neuroleptic, change of lifestyle habits. Then if they don't work, then we do some injections depends on where the stenosis is, where the disease is, as to what to do. If all that stuff doesn't work and you're still intolerable and you can't live with the pain or the weakness in your arms, then surgery may be appropriate. If the issue is a disc herniation, we can actually come in from the front and be able to take out the disc herniation, put a graft, and you can go home in 2 hours. And most often the pain is gone. So like we had a patient this week that I've known for about 12 years, and I did her original neck surgery 10 years ago, and now she has a acute disc herniation that wasn't getting better after 2 weeks and was just severe pain. And using our surgery center, we did the surgery, came in, saw the herniated disc at 6-7, took the pressure off, and she woke up after the 45-minute surgery with no arm pain. So relieved and so happy. And patient LA went home very comfortable, doing very well, and is very, very thrilled and happy. Patients that have sometimes stenosis in the back, we can come in and take the pressure off the nerves from the back and just open up the hole called the phrenotomy. Or we can come in and put, if the patient instability, we can actually put screws in. So most of these people can go home in 2 to 4 hours and back to their normal activity within a week or 10 days. If the conservative therapy doesn't work, the imaging correlates with their symptoms, then the appropriate surgical intervention can really relieve the patient's symptoms, and that's when it's necessary. So one of the things is, usually for neck pain, we don't have surgical intervention, but we try to look at other options. We look at the options of anti-inflammatory therapy, modification of their style, but we can consider certain type of blocks and injections that can cause the pain in the facet, and they don't need surgery, and we can actually help them with just injections and taking care of their nerves so they don't feel the pain. So out of the maybe 10 patients we see for neck pain, maybe only 1 or 2 may need surgery in the future.